Hi YouTube. I'm sorry that I'm making a crappy video on my phone. I just got out of work. Nice 12-hour night shifts, so I'm a little tired and I just kind of don't feel like looking for my camera or changing my clothes. I hadn't updated in a while and I was thinking about it and I was like, I made a commitment to go through this process, so I should also be documenting this. I don't know if I've had too many significant physical changes. I've definitely been having a lot of emotional changes, both related to the transition and just related to my personal life. I've had a lot of changes in the work and living and relationship situations, so pretty much all I've got right now is poor, pathetic me that's not changing, except for, oops, doing that too. I have been having a lot of trouble with my transition at work, but I guess not as much as most people. It's like all my problems seem so marginal compared to other stories, but it's just the damn pronouns. I'm working on one floor primarily where they just really just can't get a hold of it, and I try to discuss it with people and they're like, oh, it's just habitual. And that's true, it is habitual to use female pronouns, but I don't know if I need to be more assertive, but it's just not my personality, so it is what it is. And I have been attempting to transfer departments to the emergency room, and even down there, like, because a lot of them knew me before, or they know people I work with, and it's a small campus, they're like picked up on the she thing, and like a couple people have asked, and I tell them the truth, and they're like, oh, okay, and they're receptive, but still she, and it's kind of just, it wears me down. I'm tired, and I don't want to correct people. I just want to live my life. I want to be as stealth and like whatever, a regular frickin' Joe Schmo nurse. It's already hard enough to be a dude nurse, and then to have people be like, oh, let me get your nurse, she's right around the corner, and patients are like, what the shit? That's a fucking dude. But, at least my patients, so far, no one has ever caught on within the past, whenever my transition really started taking hold, or the hormones. So thank God for that. People just think I'm a gay nurse, which I'm sure would bother some guys, but it really doesn't bother me. I don't care at all. I also rescheduled my surgery and my surgeon. I'm going to be getting top surgery with Dr. Hunsaker in Miami because he's a close personal friend of my ma. And although he doesn't specialize in the procedure, he's quite familiar with it. He has a portfolio, and he's just so much better than the surgeon I had previously planned on. I don't mean in the aesthetic sense. I mean that he is not, like, it's not some really big commercial practice where I feel anonymous in a way. My consult was so in-depth and just all-inclusive, and he's so flexible about pricing and scheduling, and it's nice to feel like a really cared for patient, especially being that that's my background is patient care. I'm just a lot more comfortable with this choice, and I was able to bump my surgery up to March 8th, so hell yeah. I'm no longer going to have excess tissue on my chest, so I'm going to be shirtless a lot this summer. I better start doing those P90X DVDs again because I have a beer gut. I'm pretty excited, though. I couldn't really be happier about that part. I'm going to be dead broke for a couple months after, but I feel like pieces are coming together, and that's, I guess, I keep saying I guess, I'm just mumbling. I'm tired. That's really what I just need to figure out right now is the next part of my life. I mean, I really love where I work and who I work with, and that's sad and hard for me, but I think I need to start looking towards moving to the next phase in my life because the transition is just not working out where I am, and getting chest surgery is not going to change that because I bind and no one knows the difference anyways, for the most part. At least that's what I'm told. Unless I start going to work shirtless, I mean, yeah, that'll keep me employed. I'm going to really have to make some decisions here. There's a lot of things going on that I have to make some decisions about. But potatoes are not one of them. I'm just been kind of bumming too because I'm trying to quit smoking again, and that makes me irritable. And my brother, David, my twin bro, moved to Chicago yesterday. And so I'm definitely going to be missing him, and it sort of ties me a little less to the area. I don't even know if I should talk about this on YouTube, but whatever, it's my blog. My parents, and I don't mean my mother, I mean my parents, which people who know me know I refer to my dad and stepmom as my parents, and my mom as my mom. We kind of had an indirect fight, and that kind of all, like, they had a house in DeBerry, and it's a whole long story, but really there's no family or friends tying me to Central Florida, other than my two best friends, and they want to travel with me, so I say let's travel. But it's a lot at once, so I think I'm just going to go one step at a time, get my chest surgery, try to get a little more financially stable. I talked to my managers this morning about maybe sort of putting my move to the emergency room kind of on the back burner because I have so much other stuff going on, and it's just got to be overwhelming for me. And to be perfectly honest, I just want to go back up north and be with people I've been missing, I guess, but maybe that's just my life. Maybe I'm just this nomadic, lonely guy, and I need to embrace it. And some days are just harder than others. And some days you just need to take a nap after work. So, good night, YouTube.